All right, welcome everybody. I'm Dr. Nicole Klugers. I'm the Vice President of the Connecticut Naturopathic Physicians Association, and I welcome you here tonight. We have a nice topic that Dr. Yanez has offered to educate us on and answer some questions along with Dr. Young. At the end, we'll be doing a little Q&A. We may have a couple others on our panel. We'll see by the end of this talk, and this will be recorded, and you'll have access to the slides later on. So if you do have any questions, maybe just take a little note or maybe put them in the chat box and save them for the end. And let's take it away and give it over to Dr. Yanez, who I will introduce here. Dr. JoAnn Yanez is the Executive Director of the Association of Accredited Naturopathic Medical Colleges and the Chair of the Academic Collaborative for Integrative Health, the ACIH. She also serves on the Integrative Health Policy Consortium Education Committee. Weaving a passion for illness prevention into her professional life, Dr. Yanez's career has spanned advocacy, academia, patient care, and public health. As the AANMC Executive Director, Dr. Yanez oversees research, advocacy efforts, and the joint academic endeavors of the accredited colleges of naturopathic medicine. Additionally, she helps spread awareness of the naturopathic
That's funny.
Okay.
funny. I don't like hearing people talk about me. So
all right. Well, you can take it away and tell us everything else we need to know. So we're so excited to have you here. And oh, I see Dr. Patterson's coming in. And let's take it away. Thank you so much.
I hate hearing all that stuff.
All your face.
So, all right. Welcome, folks. Thank you so much for joining. I am excited to have this opportunity to talk about residencies and hopefully answer some questions, maybe dispel some myths, and get you all what you need tonight. So, and that said, if you're not getting what you need and there's something else that I should or can be doing to make this useful for you, please let me know. It's been a long time since I have held a Connecticut license. I was an East Coast girl for quite a long time. So this is close to my heart. I'm excited to be here. So with that said, we're going to talk residencies tonight from the site perspective. So just a little bit of an agenda, talk about the process and timeline, the coordination of residencies, kind of the back end work, application match, some reasons why residents are helpful in sites, and if you want to get started, what that looks like. So in general, we just announced the timeline for the upcoming cycle. The stuff that's highlighted here, the areas that are highlighted, you'll see are related to the sites most specifically. So we are going to be hosting Naturopathic Residency Week, our second one, October 29th to November 4th. This is an opportunity for us to showcase some of the residencies and really just hone in on a fair amount of the updates and things that students will need for this upcoming cycle. So it just kind of kicks off the season. It's when our residency portal opens. We also start with a student information session. We will then have 2 site showcase events, and these are on weekends. We have kind of gone back and forth on the timing of these. It's really difficult to find times, one collective time that works for all of the clinics, and as well students are in clinic, and so it's just always been challenging. So we apologize. I know some people don't love doing these things on Sundays, but it is the one time that we did find at least was the least of the barriers for folks. So one site showcase, we're actually doing 2 site showcases this year because there was so much interest. We had only one last year, and we had feedback from sites saying, we want to do it too. And so we had to open up a second showcase event. So then February, the application period opens. And so that's when we launch and announce the official sites that will be participating in that. So right now, once we open that portal on October 29th up until February 1st, there will be a list of all the old sites that have been a site at some point in the past. Students can look through that. They will see how the sites are listed, and then potentially reach out to some sites and say, hey, would you take a preceptor? I'm interested in how you practice. And so if you are listed on our site as a site from, either current or past residencies, you may have students reaching out to you saying, would you be open to having me shadow? I'd love to see how you work. And so we encourage that. It also helps in the interview process as well. If you've met people before, it isn't required. And we do recognize that it does present a barrier to people who don't have the socioeconomic mobility to be able to afford to go to a number of different sites. So we do want to be sensitive. Some sites will allow for virtual shadowing as well to help eliminate that barrier during that time. And so we also inform students that that can be an option as well, but obviously that's up to the site and what they want. So during that period, starting on February 1st, the students have basically that time to compile their whole application. So they're pulling together evaluations, their personal statements, their transcripts, all of that material, their NCLEX results from one to show that they've at least are eligible to take NCLEX 2. And so all of that happens in that period. So April 1 kicks off the interview period. So if you are a site, you will get a packet of a number toward the end of that deadline of application. So, you know, somewhere between March 13th and April 1st, you're going to get a packet of all the people who applied to your site. You will review it just like any job applicant. You would go through that, decide who you want to grant an interview, and then you can communicate directly with the sites, let them know we'd love to chat with you and have an interview, and you go through your interview process. At the end of the interview process, you will submit as a site your rank list. So let's say you interviewed 5 candidates and you would only be comfortable with 3 of them as your potential resident. So you would rank those folks 1, 2, and 3, your top choice, your second choice, and your third choice. And so that's how that would work as far as the rank list goes. Then the match committee convenes, goes through the matching process, which I'll talk about in a little bit. We have match day where we announce the matches, and that's it. And then you come up with your contract period. You would submit a contract to that student and pretty much take it from there. So who coordinates residencies? So the CNME basically provides the authority for the colleges that it accredits in order to oversee the residency supervision process. AANMC convenes a residency committee that's committed to postgraduate medical education. It's composed of the residency directors from the 4 schools that oversee. So that would be CCNM, Sonoran, Bastyr, and NUNM. The Institute of Natural Medicine also has a residency consortia where they convene various different sites for specific to primary care. And if you have more questions about that, I would definitely encourage you to contact INM directly regarding that. So if you want to become an accredited site, and we can talk about why later, the first step is to connect with one or more of the residency directors. So they are going to be your point person for your application to become a site. They will be your point person to ask any questions, answer any thoughts you may have, etc. So they're going to make sure that you meet the residency site requirements, complete the application, and then they will have check-ins with you. This process can vary a little bit depending on, how busy folks are, but 8 to 12 weeks is typically what we tell folks if you want to be an accredited site. If you visit the CNME website, you will see the residency handbook that details all of the actual accreditation guidelines. It's if you haven't read through standards, it might be a little overwhelming, but basically this is to ensure that there is some consistency across the residencies, that residents are not abused or taken advantage of, that there's a process for them and for sites, and baseline expectations for things like salary and malpractice coverage and CE. And so that's that's like the Cliff Notes version of the CNME accreditation handbook. So once we get the application and the sites listed on the student side, We offer a centralized online application service, and we're actually launching an app this year for the first time that hopefully will make it a bit more easy for students to navigate the portal and get reminders and things like that through push notifications. So this centralized application allows for visibility for all the sites and a streamlined, unified process. Then the match, as I mentioned earlier, is once we have the interview process closed, the site submits a list of the students they want to potentially be a resident. The students submit a list, and then we go basically like dating. First match to first match, easy pair. Then we go 1 to 2, and if we have to, 1 to 3 down the list. Any unmatched sites at the end of the cycle will they will end up having a choice, basically. Do you want to be a participating site? If so, there's a bit of a scramble, post-match scramble that happens afterwards where you can just direct hire anybody who may have applied, or we can get new applications too, depending on folks' interest or not. And so all of that is up to the site's discretion. So there are a number of benefits to hiring an ND resident, expanding the clinical opportunities that you offer in your practice for patient care, and supporting the advancement. I know, we all were there at one point. I completed a residency back in 2001, and I will definitely say it improved my confidence, my clinical skills and breadth. We just administered a survey to former residents and current residents and some students, and 92% of the folks who completed residencies said that they felt way more confident than how they were seeing their other colleagues. And so, I think that there definitely is a clinical confidence that happens. And so supporting these folks to root well is very important. So the additional benefits to the site is visibility. One of the things that we do at AANMC is we promote the sites. And so we will promote them to students. We'll promote them on our online social media channels, as well as in the portal. So you are going to have access to and visibility to the new batch of grads every year, plus anybody who happens to be scrolling through our online platforms. You'll have circulation on Naturopathic Medicine Residency Week, and we also have begun sharing videos from the site, short videos on social media channels, extra hands-on patient volume, fresh ideas in your clinic, and that satisfaction, like I talked about, in mentorship. So is a resident right for you? You will need to answer that question yourself. The residencies can run from 1 to 3 years, and during that time frame, you will have to provide various different meaningful patient visits for the resident, continuing education, positive learning environments, mentorship, and malpractice coverage, and vacation time, things like that, that are all outlined in the CNME manual. And so if and when you want to get started, contacting that residency committee is what you need to do next. So that really is probably the greatest piece of that. So like I said, we are hosting Naturopathic Residency Week from October 29th to November 4th. And I know, we've heard a lot of things from sites in the past regarding their experience. And I know we have a few sites, residency sites here on the call that I'd love to hear from as well. And so anyway, the real gist of it, you can see a little bit more on the website. You can also register into our portal just to see what the students see. A lot of sites, if they are interested in this, may just go into the portal and start to poke around and see how other sites are listing. We have a form that we require so that the sites have listings that are consistent from site to site. So we require, tell us what what you do, what your expectations are. I think one of the things when residencies go wrong, when there are complaints either from the site or from the students, Oftentimes it boils down to a mismatch in expectations and a communication issue. And so we try to make things as transparent as possible. And so when we do have new sites, we definitely implore you to be as transparent as possible. Like if all you do is IVs, or all your expectation is of a site of a resident is X, please be transparent about that. There's going to be some residents who are going to be excited about that, and there are some residents that are going to say, wow, that's not what I signed up for. And so as long as, think about any job, right? Like think about any job that you have had. If, when you know what you're walking into, it's much more likely that you're going to be happy. And so is everybody else involved. Jared, I see you have a question. Should you hold them till the end? Go ahead and shoot away if you have some questions. We're
Yeah,
mostly.
I just thought about some things as you were saying that. So if someone brings on a resident, they have to be considered an employee, or can they be taken on as an independent contractor? Is there any sort of requirement for that relationship?
I'm sorry, can you say that again?
So if we take on a resident, do they have to be considered an employee of the business or the clinic, or can we take them on as an independent contractor? Is there a requirement for that relationship?
It is typically an employee. There does need to be vacation time. And so, I can't get into contract law, and I'm not sure specifically to the requirements in Connecticut. I know that there are some states that are very specific regarding what you can't, like who has to be an employee. And so we always leave HR things up to the specific state to understand your HR laws and employment law and all of that. But it's traditionally most folks come on as an employee.
Okay. So basically just figure it out through state statutes and whatnot.
Yes.
Okay. I was also wondering how, if you did 3 total years of residency, I tried finding this in the handbook, but how many total hours does that come out to?
So typically it's, and again, in the CNME handbook, they outline the maximum hours. And so they need to complete full work week within 12-month period. And so for the 3-year residency, that would be ×3.
Okay. So it's basically like a 9 to 5, 5 days a week for the full year, and then ×3 if you do all 3 years. That's what I thought. Okay. That's all I have for right now.
Okay. Anyone else have questions? So Doctors Patterson and Young, I think you had a little bit to share.
Great. Thank you so much for that. Great informative talk here. So yes, we do have 2 other panelists here. I suppose we have Dr. Young and Dr. Patterson, who are both CNPA members and are site directors of their own residencies here in Connecticut. So I think they could speak a little bit to any questions that we have. I do have a list of questions that some members had submitted, but would either Dr. Young or Patterson like to share a little bit about their experience or any add-ons to our lovely presentation here?
I'm happy to talk about my experience as a site director. I had started a residency several years ago, and was quite picky about my matches. And so the first match I actually had was last year with everyone who went to UB knows Carolina Gonzalez, who's just absolutely lovely. So it was a great experience, and I'm happy to share, the idea of having a residency is something we kind of, as a clinic, decided we wanted to do for a lot of reasons. If we wanted to do deep dives into projects, we could give some research projects to this resident. We wanted to be able to have someone who could see patients for acutes, but also to build up their patient base and have that experience. So it was really to enhance all of the doctors in the clinic's experience, and then also be backup for us when it came to helping with deep dives in clinic cases and that type of thing. So the perks I've seen for my residents is that they have a salary that they can depend on, which is, as we know, when we first get out of school, a really refreshing thing. And then they can focus on being a doctor instead of, all of the different aspects of being a business owner. They can just refine their skill set, find out what they like, try different things. And so my recommendations would be, when you think about having a resident, think about what their whole week is going to look like, their quarter, their year. Who is going to be the overseeing doctor? Who is going to be the one that's going to be the go-to when they have a scary case and they need some help immediately? What kind of patients are they going to see? Are they going to build their own panel? Are they going to see patients of the clinic already? You want to think about how they're going to fit in with the group and what your goals are with them. So when you see the different people come in to interview too, you can kind of gauge, like, is this someone who wants to do a research project? Is this someone who's going to want to write up case studies? Or is this someone who's going to want to present at our grand rounds, or those type of things? I've seen the past couple of years having a resident that it's upped our game in a lot of different ways. You can have them do research projects and bring back things. You can have them present at group meetings and that type of thing. And so it can really kind of bring you back to the academia that you had kind of stepped away from when you weren't in school. There are a lot of great resources to help support you through your residency, JoAnn being one of them. But also the site directors are incredibly helpful at helping you navigate difficult scenarios, helping you get the information together. You can ask them, like, do they have to see 37 hours worth of patients? What do we do for this scenario? Because there are a lot of requirements, but that's their job, is to set you up for success. So one of the things that can really be helpful is having that liaison to help you kind of navigate setting it up. What should it look like? What do other clinics do? I want to be competitive and make sure I'm being fair to the resident. And then also with that, there are some resources out there to help with financing it, because, typically a resident isn't seeing a full day of patients aggressively like you would be when you're when you're rocking and rolling once you're out of school and established, because they need time to kind of process it and learn and reflect and those type of things. And so, there are resources like INM and NERC, which can help with funding and can help with other resources that can help kind of offset when your resident is still kind of ramping up and needs to only see a X number of patients a day and may not, be like the profit margin might not be profound, but there's these other resources that can kind of help make your resident meaningful in that way too. So I would suggest looking at those other resources. NERC and INM did a project last year, which was really helpful for me. Dr. Patterson, I don't know if you got to do it or not, but they did a site director training. And so basically Friday nights, I think like 5 or 6 of them last year, I was parked from like 5 to 9 or something crazy, learning how to teach, which is something we don't get taught in school, how to be a site director, and how we all learn differently and how to play to everyone's strengths. And, you're taking on different personalities and how to make it work. So that's another thing, that there's a lot of resources to set you up for success as a resident director. So I know it's an intimidating role to I mean, who am I to be teaching other people this stuff yet? But, we are in our medicine with our patients, but there's a lot we can share with people, and there's a lot of resources to set us up. I mean, like JoAnn's here tonight, like residencies are so incredibly crucial for the health of the naturopathic community, especially since the East Coast has lost its school. This is a way for us to really draw students to the East Coast and retain them. Essentially, a resident is a 1 to 2 year, I guess there's some 3-year residencies out there, but it's a job interview for a year. You get to see how someone practices, get to see them grace under fire, you get to see what they're eating for lunch, you get to know them and see if they're going to fit your culture. And that's a great way to try somebody out for a year. And at the very least, you're setting them up for success and wherever they end up, but you also get to know them. So the more Connecticut residents, the residencies we see, the better. And if anyone wants support, I'm happy to do that on the back end. Shoot me an email, and I'm happy to give you some resources of things that I've learned and kind of fallen into along the way, because I think this is really incredibly important for Connecticut.
And Lauren, just tag teaming on what you were saying, I think one of the things we also hear from site directors, like you said, as an ND, you're not taught how to teach. You're not taught, honestly, how to lead or how to mentor. And there are resources for helping the sites. And so I think it really does elevate, you obviously work as a clinician and you're doing good work there, but how are you leading your team? How are you as a leader of your clinic? And so there's so much more depth there. I know, and I think of where I was 20 years ago and even 10 years ago as an employer, and how you grow and how structured mentorship like this can help you start to frame your own growth as a person and as a physician and as a leader, and continue on that. We think, well, once you graduated. Well, there's always growth as a professional, as I'm sure you all recognize. So Dr. Patterson, I'd love to hear your thoughts on this as well.
Yeah, sure. So this is my first year to have a residency. So I know Lauren's had that for a bit, of time experience. So there was definitely a learning curve. I think the first piece is to being clear on, you kind of alluded to, it's like the type of person you want. Like I wanted to really have a better understanding, like how they were going to fit into the team in the interviews, because it's good making sure obviously somebody is competent, knowledgeable, feeling like they would be good as a doctor, but also how are they going to fit into your team? So that was a crucial piece to us. So not only did myself and then also Dr. Medea interview, but I also had my team interview as well, just so that I could kind of get that sense and feel more confident with the decisions, like moving forward, of who we recommend, or who we wanted to actually be at our site. For me, I think the biggest push was really, it's like the future of our profession. It's like it would be easier to get, another doctor probably than a resident, but I really felt like I was invested, or I've been more invested, especially with us losing the school at UB, that there's not really that opportunity for kind of like mentorship and things like that, outside of preceptorships, which we used to do before. So this gave me an opportunity to be able to kind of develop basically future doctors, and hoping that they can also be successful. And if it worked out, potentially continuing and staying with us. But if we don't kind of support our future profession and also them being successful financially, then we're going to fail, as a profession. So that was kind of my impetus to doing it in the first place. And so the first thing was like making sure fit in with the team. I think the interesting thing when you start is looking to make sure you're clear on like what your practice does and your areas of focus. I think, I guess I'm looking at like learning curves, of we could have been a little bit clearer on that, because our areas are pretty specialized, even though we do see people, all over for family, kids, adults, everybody. I think I know you guys have it separated when you guys do those webinars where it's like primary care practices versus like specialty. So I think I would have been more focused on like specialty, so that we ensure the people, I guess, for the future that come to see us are like have a huge interest in those areas of specialty. Because, for example, Lyme disease, if you're not from this area or the Northeast, which is a big area of focus for us, like 50% of our patient base, there's like either not as much knowledge, or there's not as much people are not as aware of it. So making sure you have like a fit based on their interests is really important. And I think like now I'm more clear on that for interviewing for the future, which I don't think I did the best job of when I first started. Also learning how to use the person. Like one of the other important things for me was how to foster that person to be able to do things that they were interested in, but they're also not really sure what they love and are passionate about, because they're just new into this. So with our person, really over the first few months, we really spend a lot of time, Dr. Medea, on like going through the review of systems. Like we actually like things like physical exam, testing things like EKG, like making sure they felt really competent to go forward with being able to see patients on their own. That was really important in the first month. And then And then after that, kind of getting an understanding of what she was interested in. So the person that we have at our office now, she's really good at like sports medicine, nutrition, gastro. She really loves that. So we found a way to augment that in our practice, where she does a lot more of like the nutrition plans, the like more the GI sport, the things that I guess to what Lauren was saying, like sometimes we also don't have time to do. And what we found, one of our issues, because we're a cash-based practice, it's also different cash-based versus insurance. People don't often like want to pay the same if they're going to obviously a less experienced doctor. So having her focus on that was helpful, but then also we had her focus more on like those plans that were like adjuncts to us that we might not have had enough time to go through in the visit, which the patients were like super appreciative of because it gave a more like comprehensive care. Also, she helped with other things like research. They're required to have research, but then also like even like our EMR system, like template system, reports, they're younger, so they're more like flexible in terms of like understanding, like navigating like technology and things like that. So that's also been helpful where she will go in and, I say, oh, I want to create a template or a protocol for this. This is our protocol. Can you look in how to develop it? And she like gets that done like right away. So that's been helpful. Even looking at things like labs and flagging them so that we, as we get tons of labs in, having them look at things like that to consider or flag for us to review. So looking at ways that they can like help support your practice too, that are clinical, that you may not have enough time to do, but would be really interesting to someone that would come in. So I think, yeah, basically identifying like what the needs are, what are the things that you can like get them to do outside of the regular clinical care that's also clinical nature, but also helps to support you, being really clear on like what your practice areas of focus are. So you recruit like the right person that's a right match for you. And then also like developing over time, helping to support them develop over time to feel comfortable with like what is the area of interest to them. So it's been a really good experience. Everybody kind of does it differently by what they offer, like in terms of benefits. Like with us, we offered the salary, the 37-hour thing was challenging because we only work Tuesday through Friday. So her admin day is Monday, where she does the research. We also covered a certain amount of CME days. Like I sent her to like, for example, the Arizona conference and paid for that. We cover insurance. So that'll be a question like what other benefits. So we cover insurance, we cover vision, we cover dental, we covered the malpractice insurance. And then obviously like helping to get on board for licensing. Ours was tricky because our person was a little delayed because she was from Canada. So we had the whole visa issue. So that took us like an extra month to get all of that situated. And Connecticut had an issue. I don't know if you had the same thing, but like with because after 2020 with COVID, like getting the license right away, it took a lot longer than normal too. So that extended us probably like 6 weeks before she could begin. So those are like the little hiccups, but they will definitely be interested in like what other benefits they get outside of, the salary, what the schedule looks like. So I think that's it. It's been a really good, positive experience for me. And I look forward to like continuing to be able to contribute in that way for our profession. And then also it helps our practice too. So.
Thank you so much for sharing that. And so I think there are a few other things as you were speaking that came to my mind. So with any new site starting this, and it sounds like you did some of this, but starting with introspection. So what are you good at? What is your culture? Because again, when I get the letters of complaint or concern, it's usually a culture mismatch, honestly, or mismatch, like I said earlier, in expectations. So really understanding who are you as a clinic, who are all of the players in your clinic, what is your culture, there are some clinics where you are literally running from patient to patient, second to second, from the moment you walk in the door until the moment you leave. And there are other clinics that are like chill and, and meditative. And it's like, those are two different personalities of people that you're hiring for. And so, really just get clear on who you are so that you can hopefully get the right fit for you, whether it's a resident or a front desk staff or whatever. Like all of these will be ultimately transferable and helpful down the line. And then, as you said, Jaquel, one of the things that we changed last year was we changed up the form a bit for site descriptions to be much more specific, and also to kind of force the sites to decide, am I primary care? Am I, focused in a certain area? What patient population, like what percentage do you see of pediatrics? What percentage? Because sometimes folks would say, well, we're an oncology site, and maybe they're only 50% oncology at the end of the day. And so if you have somebody who's wanting to get their FABNO, and they're going to come in and, because they thought you were an oncology site, but you're only really truly seeing 50% of your patients as cancer, then there's a mismatch there. So just, as clear as everybody can be, if you have specific expectations, like we'll even tell folks, share your expectations about the contract during your interview. Make sure that, folks, you come to some meeting of the minds. You're not going to offer them anything at that time, but make sure that there is clarity on, what your expectations are in your contract. If you are covering malpractice and all of that, be forthright with that. Let folks know what you cover, what you don't cover, so that they can make informed decisions. Lauren, I see your hand is up.
Think I'd be really good at clicking all this with all the Zoom meetings we've done. Well, off of that, I was going to say, unique to Connecticut, and I found this, and I don't know, Jaquel, if you have, people aren't aware of our scope of practice. And right now, since COVID, we aren't doing a jurisprudence exam. That is coming back, spoiler alert, but for right now, it's not. So these residents don't really know the scope of our practice in Connecticut. And that is something to make sure you're clear on. If they're really passionate about PRP, that they won't be doing it in Connecticut. And just to put that out there ahead of time is one of the things that I would recommend. And I love the point that Jaquel made too, of like, we get so much CME fed to us through our feed, right? Gaia Pro, all this. I'm not plugging any particular one. I just saw that one the other day. There's so much CME that we would love to catch and see online. I routinely will kick that over to my resident and be like, hey, you want to listen to that and surmise it for our group? And we'll go over that at our next meeting. And so it is incredibly great for our team. I've seen us all up level with the ability to have a resident who's a little more steeped in academia bring that to the clinic. So while it is altruistic for our profession, it is definitely enhancing my clinic. And it sounds like, Jaquel, you're the same, like where we're better for having residents in our office. And I'm sure a lot of other people would too. So I'm happy to give any like kind of nuances of how to employ somebody, like other resources you can ping, that kind of stuff, if anyone needs help with it.
Great. I see a couple questions here that might be helpful for our panel to shed some light on. One of the questions that we had from our members were, when did you feel like you were ready to take on a resident? Was it anything to do with your revenue goal or number of patients on your waiting list? And when was that kind of turning point for your practice site?
I know
Jaquel,
for me, I did have the benefit of Dr. Medea used to be one of the clinical coordinators at the PA program at UB and also at the naturopathic program. So I knew that was the other push that I forgot to mention, was I also wanted to support the other doctors in my office. Is like, she loves to teach. So part of also why I had the resident was because now it gives her something that's going to fuel her to teach somebody else. So that, I think, I felt ready when I had more of a team to be able to do that. I think if I was just by myself, that would be hard because there'd be a lot of time and oversight. So I wanted to make sure there were multiple people there for them to connect and talk to and ask questions so that they were supported. So I would definitely say I didn't feel comfortable until I had like more rooted and established people at the office. I think that's it. I'm trying to, there was probably more detailed question, but that was the step that made me feel, once I felt like my team was really solid, that now I can go and actually get a resident that I know can be fully supported.
The AANMC a number of years ago gave a presentation on ramping up ONC residencies. And they had indicated from a financial perspective of having about 18 months in revenue. I don't want to scare folks, but having a certain amount of revenue, basically, because you are going to have to pay their salary for, several months until, depending on your billing model. If you take insurance, I don't have to tell you how long insurance can take to pay you. So, making sure that you have ample reserve funds at the front end of the residency until the money starts coming in from what they generate. So that is another piece of just making sure. And if you do an I&M residency, you will need to furnish P&Ls and bank statements and things of that sort. So, that's just for them to make sure that you also have the financial infrastructure to be able to support a resident through the entire commitment. So just from the money perspective, that typically are saying about 18-ish months, even though you're not going to need all of that to pay them, and they will generate revenue. But that said, it just gives you enough of a buffer so that there's no sweat coming off of your brow at the end of the week when you're signing checks.
And you just prompted me too. That was the other thing, is I made sure whatever they were getting paid, how many visits, I did calculate ahead of time, how many visits would that be per month for me to break even? And then I'm always a person that always is more conservative. So I'm like, okay, can we lose that if they bring in nobody? So for me, it's like, if can I afford the cost if there's not absolutely like one dime of return on my investment, which I could. So that was also how I looked at it. So that helped to make goals too for that resident of like how many people they needed to see in a month, so that I knew at minimum I was getting my ROI. I didn't care so much about making more than that, to be honest. I really wanted to just, at least for this year, just try to break even on it. So.
And it sounds like you had a lot of non-tangibles too, that were not just financial benefits.
Yeah, that is true. Yep.
I had a quick question, and this may be a bit specific. I've actually been running with like an unofficial, unaccredited residency, and I was just curious about if it's come up for you, how you've handled leave, and kind of specifically maternity leave, because this just came up with me where my position actually is kind of critical to the flow of the clinic and everything. And now to all of a sudden not have somebody for a few months, it was very difficult.
I've fielded, I have a lot of uteruses in my office. I'm trying to think how many maternity leaves I've covered. A lot of them. And the nice thing is in Connecticut, we have paid FMLA, which is wonderful for our staff now. And I mean, the nice thing about maternity leave is, it's coming a little bit, so you can kind of plan around that for your team to be gone. I don't think that those months would count towards any kind of patient care as far as like an official residency. I guess you're just wondering how do you handle holding the position for them, or?
Yeah, you just kind of, it sounds like you just kind of have to grin and bear it. I'm just coming out of maternity leave, so I'm like it's been tough. It's, not having a person that I had, filled the position for. Of course, we had time to plan, but you just like never plan enough, and then hiring somebody in, like temping the position to train somebody, it is rather difficult,
I think we prepped our patients on it for most of the time. And I would say most of, I had like 3 weeks maternity leave, and I think my staff
it could be 12 weeks, right? I was going to ask.
Yeah, no, it's 12 weeks, and it's
yeah.
I would say it was 4 to 6 months for most of my doctors, and we basically trained the patients to know that they were going to be out that time, and you basically prepped your staff and your team to like downsize a little bit and kind of like flex that way. But before 4 months or 6 months, as we both all know, like goes very quickly. So
not quick enough.
I mean, that's what got me to say like, okay, I have to expand and have more people on the team, because it was just too much weight on one person to have that. I'm trying to be like Lauren, who practices 1 day a week or something like that, and then you manage the rest because then there's no back like for the cover. Like when these things happen, it's like you need more support to be able to flex a little bit. So
I will say that having a resident gives you that wiggle room, right? Like, so if we have someone call out, whether, I mean, even if it's an MA, if there's downtime for the resident's schedule, the resident can jump in, shadow one of the other doctors and be the MA. Or, if someone's out for like lovely COVID is hitting everybody, right? They can step in and cover the acutes if we need to. So it gives some like of that more tolerance to your clinic to be able to handle the highs and lows if you have someone. Honestly, so I've hired physicians and I've hired residents, and I'm a much bigger fan of hiring residents at this point, and I'm kind of leaning towards everyone goes through the residency model first, because it lets them just not worry about getting enough patients and worrying about the quality, which is really important. So I guess it's also, why do you want a resident? Do you want a resident because you want an associate, or do you want a resident because you're at a place where your clinic wants to step up their game, and those things can be the same thing too. I mean, I have a feeling most of my residents will end up being my associates, but they're kind of a different goal. Like I don't want my I just, bringing on an associate, there's an expectation that they have to see more patients essentially, and they have less time to hone their craft. And I feel like that is a disservice to them. And I really feel like residencies are the way to go. The other thing that we do, and anyone could do this in their residencies, is they rotate not just through our clinic, but they go to other clinics. So again, I'm using Carolina because she was last year, but she rotated through a midwife clinic and got to do a bunch of OBGYN stuff, missed out on a birth, but like got to do 12 hours with midwives, got to do a few days with surgeons, got to go in with a lot of different other orthopedic surgeon, breast surgeons. So got to do a lot of things that otherwise, I mean, we never got to do as naturopaths, right? And so yes, she got to do that and I was paying for her while she was over studying, but she was also this liaison for our clinic in a breast surgeon's office. And now we have this great integrative relationship with a breast surgeon. So it can help build more relationships in the community too, to have this commitment to education and academia in your clinic.
One other question about just kind of that application for like looking at people that are applying for or setting up a residency. Do you guys have any suggestions on how to tackle the whole application process so it just doesn't feel so big,
So that's actually something we're looking at AANMC, is how can we break it down? Can we put it into a Google form, or is there like a different way that we can present it so it doesn't feel overwhelming? Because we have heard that from people. But there are some basics that the schools absolutely have to have to ascertain, is your clinic ready for this? And also to make sure that you understand what you're signing up for as well. So
yeah, right now the documents, like, as I know, like for me personally over the years, I, request the information. That's one of the reasons why I wanted to sit on this, is just that it just has been just so much paperwork that I just don't, just getting all the logistics of everything down.
I think
it's a lot.
For our team, we reframed it as kind of like an opportunity for introspection. So basically taking it a chunk at a time and really just looking at like, what do we want it to look like? What are we about? Who is going to be involved? And like, it was a deep dive, but like more looking at it as like, this is in the investment we're going to do this round in deciding on like who we are and what we want to be, and kind of using it as a means to kind of help define us as a clinic. So taking it more as like an opportunity to, even if you don't have a resident, to kind of like refine who you are, kind of thing. And then it also has the dialogue around like, because you have a bunch of doctors in your clinic too, who wants to be involved, right? Like, I don't actually directly oversee my resident all the time. I have other doctors on certain days with her, and so like it offers the opportunity for everyone to kind of build this together too, which was really like helpful, I think. So that's not helpful. It's still a lot of paperwork.
I mean, the good thing is after it's done the first time, I mean, me submitting for the second time was like super easy. So I think, but I also had help. Like we kind of split up some sections of it, but it did teach us a lot about the clinic, but at least like the second time was like so easy. I mean, I didn't have to spend much time. So it's kind of like that first time you have to input it, but not in the future. It's not so bad. Unless hopefully they don't change the format completely.
Oh God, yeah, don't do that.
Because I kind of liking the it was like maybe half an hour's worth of edits. So
it's interesting, the people who decide to go into residencies and the ones that just are looking for jobs too. It's different. I do feel like we pull a lot more from the West Coast when we are doing a residency, because there's a lot of people motivated to, there's just a different mentality sometimes. And I think that is going to be necessary, like I said, because we don't have a school here. So if we want associates out here, it's moving across the country. You need to know you're going to have a salary and health care and some paid time off and something. And a residency does offer that. So I think it's going to make us more attractive to a lot of people in the schools on the West Coast, which is going to be important.
So
Yeah.
this talk originated because I was at the AANP conference and I was talking to folks about my concern for the East Coast states to make sure that there is a pipeline for students, a consistent pipeline for students to all of these states that we have worked so hard for to get licensed, like Massachusetts and Rhode Island and Connecticut, and make sure that these licenses don't go the way of Florida. And so that was really kind of the impetus behind this talk, was to make sure that we start to create a pipeline to get students back east at a time when we don't have a school, and to be intentional about that. And so, again, not everything is magnanimous. Dr. Lauren and Dr. Jaquel have both talked about a lot of the benefits that they have seen personally. But there is kind of in my brain that underlying thread of, we need to make sure that we keep seeding new grads to Connecticut.
Yeah. And I do think, the one challenge with that is like our scope. And so I think that's a good point Lauren brought up, because that was one of the questions we asked in the interviews of, like, some places, some of the clinics they were interviewing with did a lot of like IVs, and the person was not interested in doing it to that capacity. And we're like, well, we don't have that, but we do have like a nurse practitioner here that's here once a week or twice a week that you can shadow with, and those types of things. So I think it's good to have those conversations up front. But for this like second go around, I really wanted to make sure too that I had somebody that was interested in staying in the area. So it's kind of to what Lauren's point was, it's also, are you looking for like a future associate? So I think being really clear on what that goal is, like for me, it's like, okay, this is great, but now how do we also use it to build capacity? And so people from the West Coast, a lot of them are there, but they're from, Connecticut and the Northeast, and they wanted, like when we interviewed, people wanted to come back home. So I think somebody that's also rooted and has an interest in the area is also helpful for future, if you want to do it more than a 1-year residency, 2-year, or potential associate too. So that's kind of where we've shifted a little bit for the subsequent times that we will be looking at residency.
And in Connecticut, how many applicants? I mean, are you guys getting a large pool of applicants for your official residency positions here in Connecticut?
We had a decent amount. I mean, I think how many did you have, Lauren? Because I
think we had 5 or 6 that we interviewed aggressively after we looked through all the applicants, because like they have this like big essay and all this stuff, and then you kind of like reach out to the ones that you want. I'm not the celebrity that Jaquel is, so
oh no, we didn't have that.
But I mean, so yes, we have a limited scope. I don't want to undersell Connecticut though. I love our scope. I love what we can do. We're covered by insurance. We can treat everyone, not just the worried well. There's no fear, because there is this reputation for some of the residencies to just make you end up being a bot that does IVs, like that, where you end up being like almost like a glorified technician or an LPN or an RN. That's not going to happen here, because we can't do that to you. You're going to see patients, you're going to see pathology, and you're going to learn a lot of stuff, because we have an ability to order labs and imaging, which a lot of Canada doesn't have the ability to do. And like, I love our scope. I would love more of a scope, and but like I think that we have a lot to offer. So I think not to sell ourselves short around the residency thing too, just to be clear about it, because I think again, people don't really know,
And again, going back to the things that we offer to provide site visibility, do it all, like do the little 30-second videos, get your site description really solid and tight, and talk about the things that are amazing about your clinic and what you do and what you offer. I think that, like you said, don't short sell yourself, Lauren, just because it's Connecticut and the scope is Connecticut scope. There is so much that folks can get from this. So I think that, again, going to what you were saying, piggyback off of that, when we hear complaints of students, it's, I was a glorified MA, or, I was just, like, just shadowing or not really like doing anything. And they're in this to learn. They're in this to get mentorship and to get better and, you know, and to feel solid as an ND while they're just kind of fledgling starting out. So, you know, I think that the more you can sell that mentorship, the more you can sell, what, you know, how they're going to fit into this clinic and what they're going to get, you'll see applicants. And, you know, I think we do see it because I see the prospective students, and we have, you know, every single day I am getting prospective student applicants from the East Coast, from New York, from New Jersey, from Pennsylvania. So, you know, we have those folks in the programs. They are already in the program. So, you know, I would just tie that back in and make sure that they come back home.
Thank you so much for your time tonight, JoAnn. I know this is a lot. You're a powerhouse across the country. So thank you so much for your time for Connecticut.